In ABG, pH
1.35
is
to
first normal. You can keep as now we just remember at
7.35 to
7.4.
7.
But if not 7.4, you can remember the range 7.35 to 7.45.
45.
Bicarbonate value is going to be 22 to 26. Carbon dioxide is 35 to 45.
45.
To calculate ABG, step 1 is to know whether pH is more or less. If pH is less, your answer is acidotic. If pH is more, your answer is alkalotic. Second step is to know whether it is respiratory or metabolic. To check that, we have our technique which is known as ROM, which means respiratory opposite. The meaning of respiratory opposite is that if my pH is increasing or decreasing, it should be opposite to the sign of carbon dioxide. For example, agar pH is less, to call it respiratory, CO should be more. If pH is more, to call it respiratory, CO2 should be less.
Less.
This is then your answer will be respiratory. To call metabolic equal, which means whatever sign of pH is either increase or decrease, it should be same to the sign of bicarbonate. Which means if pH is high, to call it metabolic, bicarbonate also should be high.
Right.
And if pH is low, to call it bicarbonate, metabolic also should be low.
Low.
This is ADG. Difference between compensated and uncompensated and partially is compensated is after your answer, if the answer is coming between 7.35 to 7.45, it is compensated. Uncompensated means if you're having acidosis, okay, in the question, acidosis is the issue. To correct acidosis, bicarbonate should increase. If there is no change, then it is known as uncompensated. If issue is again acidosis example, you see that there is change in bicarbonate. Suppose from 22 to 26 it came to 26. Oh, sorry, it came to 28. Okay, but still the pH is not between 7.35 to 7.45. Then your answer is partially compensated. Are we clear?
Yes.
So
Sir,
ABG
can
is
you
the
brush up in a minute, like very quickly?
what?
Can you brush up in a minute, very quickly?
ABG.
This one, ABG.
The whole thing again. One more time.
Yeah, very quickly,
Yes.
short.
Sure, no issues, no issues, no issues, no issues. pH is normal 7.4. Okay. You can keep as a range whenever the answer is around maybe 7.3, 7.4. You have to keep a range of pH that is 7.35 to 7.45. Bicarbonate is around 22 to 26, and carbon dioxide is 35 to 45. The first step to calculate in ABG is pH. If pH is rising, it is alkalosis. If pH is falling down, it is acidosis. The second step is to find out whether it is a respiratory condition or a metabolic condition. Our mnemonic is ROME, respiratory opposite, metabolic equal. ROME says to give your answer as respiratory condition, the pH direction should be opposite to carbon dioxide direction. So if pH is reducing, carbon dioxide should increase. If pH is increasing, carbon dioxide should decrease. Then your answer will be respiratory condition. To call metabolic equal, it says whatever direction of pH is, it should be as the same direction of bicarbonate. So if pH is increasing, bicarbonate also should be increasing. If pH is decreasing, bicarbonate also should be decreasing. To know the difference between compensated is whatever value you get. If it is coming between 7.35 to 7.45, it is compensated. Uncompensated means what? Uncompensated means what? If, for example, we're taking acidotic environment, to correct acidosis, metabolic will work by increasing bicarbonate. But if bicarbonate is not increasing, okay, for example, in our exam it was 25, after it was also 25, means there is no change. The metabolic metabolic pathway is not helping, so it is meaning uncompensated. But if same question acidosis is there, we saw that the bicarbonate increased maybe to 2 or 28, but still the pH was not coming between 7.35 to 7.45. Now you will call it as partial
Compensated.
Compensated.
Okay.
Sorted? ABG, very sorted?
Yeah, perfect.
Perfect. Okay, so we are almost most welcome. So we are almost done with, I guess, 12 to 13 chapters. Upper subjects we are done superficially. We talked about detail in OB-GYN because many people asked me, please teach OB-GYN. So that's why I took a good full day for that. First day we were able to cover surgery, medicine, pharma in detail. Second day OB-GYN. Yesterday, what we studied? I forgot. What we studied?
ENT, optal.
Opta,
Derma,
Opta and
optal.
Derma. Opta in detail we covered. How was yesterday's grad test?
It was good.
Doctor, I was not able to review.
Why? The answers were there.
Yes, doctor. There was. It
Yeah,
was
we were not able
After
to
11
review,
o'clock,
doctor.
we can see.
Now it is
Actually,
open. Now you can check.
Yeah, after 11 o'clock it's open.
Yeah, now you can check. Now you can check. Huh? So now we had a good combination, and today finally we finished 4 more chapters, 4 more subjects. So I hope this couple of hours which we did 3-4 days was useful. Was it? Was it good?
Yes, sir.
Yes, sir.
Definitely.
Definitely.
Thank you so much. Okay, I see, and I'm not like Bordy, you have a doubt. Yes, tell me what's your doubt.
Pediatrics lecture.
Sorry,
In your pediatrics lecture, can you able to hear me?
I can't hear. What are you saying? Sorry?
Pediatrics.
Patrick something.
Yeah, see, what I was saying with pediatrics is if you will go on my YouTube channel, right? There, 3 subjects I'm already done with: pediatrics, anesthesia, medicine, and derma also.
Yeah,
So
sir, I have one doubt in vitamin D deficiency. Rickets,
yeah,
you said the treatment is 3 to 6 international units of vitamin D.
Haji, yes.
But when I studied FMG solutions, their explanation is 15,000 international units.
No, this is my
And the
Dr.
3
Singh.
to 6 doses they are saying.
See, what I said, 3 to 6
Hmm.
international units is from Dr. Singaram from Marrow Pediatrics.
Okay.
So my source is that.
Okay,
FMG
sir.
solution.
That was confusing.
No issues, no issues. FMG solutions, there are a couple of questions which are very wrong. Even my name is there in the, who has helped and all of that.
Yes,
Because
doc, I
when
saw
I,
it.
yeah, when
Edition
I,
7 or 8, I guess.
yeah, when I was solving it in OB-GYN, only around 50-60. There are so many questions. I guess 500 questions are there in OB-GYN, but around 60-70 questions are wrong because the students only are the one who are compiling it. So make sure whenever you're doing any PYQ also, it should be with a proper author, like Prep Ladder or Marrow or any institute, because at the end of the question mark, it's written citation, what source you used. So they are more valid.
Okay.
Yeah. So, so that was it. Please, this FMG mantra is not just like I'm putting the slide randomly. This is actually the way you get it done. Make sure you use your images daily. Even I know images you're like, baad mein kar lunga, I'll watch it later, but don't watch it later. Do it every day. Okay. You have to make. That's why this last today I gave so many images. With respect to last years, you have to make sure 5 years FMG should be done, 5 years INI should be done, and 3 years of at least 3 years at least you should go with INI. Okay, because directly you'll come. And main thing is you have now around 3 weeks, like exactly to be honest, around 17 days. Don't stress. If you have so much to leave, I told you about myself as well. Even on the last day, I was not confident about myself. Everyone is going to have it is for everyone it's going to be the same. You have to make sure that your mental peace is at rest. Because in the exam, one reality check I'll give you, there will be half the topics where you'll be like, yeah, what is this? But if your mind is calm, you will solve the answer somehow. How? If there is a question where you have no idea what it is, see the options. Because in the options, out of at least 4, 2 to 3 so you have heard here and there or somewhere. And if you have revised nicely, you know that, for example, if there is a topic, let us talk about pellagra. Pellagra is a vitamin which deficiency?
B3.
Niacin.
B3,
B3, B3.
not B2.
Niacin.
B2 is no, it's not B2. Riboflavin, no.
Niacin.
It is vitamin B3 is this one. So now if they were giving a topic which is unrealistic to pellagra, something with respect to, let us talk about like, when we were talking about, remember carcinoid tumor?
Yeah.
In carcinoid tumor, what did I tell you? That because of the increased 5-HT is there, what
Yeah.
thymic was required to convert to niacin, that all went to serotonin and dopamine. So, for example, if you never knew this topic, and there, at least in 3 options or 4 options, your answer is niacin. Now, niacin, also known as pellagra, you'll have this Castleback necklace. So, these hints will be there. If you don't know a question, it's okay. You will get hints. Either it is from the option or either it is from the whole paragraph. But you will only be able to find these hints if your mind is at peace. Please make sure that you do this very well. ठीक है?
Yeah. Okay, doc.
चलो, God bless you guys. ठीक है? If
Doc,
हाँ जी.
Actually,
Doc, about that video that you mentioned, what sort of video you want from us?
Which video?
और Instagram.
Short video you asked na for the
Stories that we have put.
Arey, just a second. If you have any videos, I'm asking. If you have any which we're recording something, just send so that I'll put it as a reel. That is it.
Okay.
As a reel, simple reel. That is it. Okay. What I was going to talk about, yes. If people have issues with biochemistry, Dr. Nikita Nanwani's 2 videos are there in YouTube for 30 minutes or 40 minutes, something like this. Those videos you will watch, right? Almost all your topics are covered in biochemistry. Do that along with 5 years of FMGE, 3 years of INI. You will see that. Okay, sunflower, see your message. What is your message? What is it? I am
the
able to.
biochemistry page again.
Dr. Nikita Nanwani's mega revision. Dr. Nikita Nanwani.
Okay.
I am able to explore 2 options, doctor, but in 2 I am confused always in them. Okay, and I'm not able to differentiate. But I'm not able to. See, the issue with that thing is, see, whenever you're doing this, one thing is that okay, your concepts are little bit here and there. You have to make sure that your confidence is strong. Second thing which I told you is trust your gut. Half of the time, maybe in this exam also, like in hyperactivity, we click something or yaar, why you did this. Whenever you're watching the question, make sure 4 things you should see. If the question is clearly asking none of the above, all of the above, except like this, you have to see. Second thing is that when you're reading the question, read it calmly. Make sure that you are not being in a hurry. Obviously, time is going, no problem, but at least make this question sure. To make sure that 2 questions are there, first of all, what from inside you have that gut wala feeling. Most of the time, that is right. Half of the time, what we do, we make it, and if we go, then when we are coming to cross check again, you'll be like, yeah, I don't think this is the answer, and then you change the answer. First answer which came from your mind, and you feel it is the right answer. Okay, move on. Second, whenever you're checking your answer, first you mark the question. Okay, after that, what is our rule? Ki before going to the next question, imagine that you haven't given the question and you have to read the question once again. For improving this issue which you're saying, right, that excluding only option, that thing, your concept should be very well, and at least do the previous questions. With giving questions again and again, with practice questions daily, these people who are saying, practice 100 questions daily, are nonsense. If you will practice 100 questions daily, how will you first solve the 100 questions? It will take you at least, if you're doing it normally, 100 questions, around 1.5 hours, it will take half an hour break, 2 hours to review all these questions, 2 more hours, 4 hours went here, 1 hour of torture. Okay, the questions here. At least do a session, minimum 50 to 60 questions, and revise. Now, don't give any new questions. Whatever you have bookmarked, if you have bookmarked anything, or if you have highlighted the books, make sure you're reading those questions, because those were the wrong things. Simple mistakes we should avoid. Be prepared, there are going to be topics which are going to be out of the box. But in such a situation, not to panic, see the options, because in the options, some topics are there which we studied. So we know that in those topics, this was not discussed, rule out, rule out, rule out. Okay? Not getting enough confidence in pharma and at patho. Okay, see, whenever these topics were there, no? Pharma and at. These are rattafied topics. Pharma, like what you have to do is take a chart, okay, or if you have your notes, you have your own notes. In pharma, what they're going to ask is, that's why in the first day we discussed so much drug of choice and mode of action. Lesson mostly whatever I discussed are previous year questions. So make sure at least that you go through very well. Along with this, mode of action is very important. So if you're not able to get done through all pharma, at least do the mode of action and drug of choice. And pathology, microbiology is also ratta. But Dr. Preeti ma'am is there. You just see in prep ladders, there is this free one-liners. Prep ladder has free one-liners on YouTube. So there, Dr. Preeti ma'am, she explains. At least go through that. Any subject. What I am asking is, don't miss even one subject. If you have less time, if you don't like the subject, from deep core of the heart you hate the subject, at least do this LLRs. Last minute revision, prep ladder, that also free. Don't need to pay or something like that. Do that and do your previous year questions. At the end, if you don't want to do anything, last 5 years FFG, last 5 years DPG, and last 3 years IMA. This too you have to do. Are we clear?
Excuse me, sir.
Sir, I have a doubt actually.
Hello.
Yes, please.
So, will you put this on YouTube or anything? Because in pharma, the fat guy you draw, I have issues in that topic. So, will you post this or what?
Give me a day till tomorrow. I'll post it because tomorrow my duty starts. My first duty starts over there. So once I'll get done with that, I'll post it.
Okay, thank you.
Huh?
All the
Chemo man
best,
is
doc.
very easy. Chemo man is just we have to remember. Okay, first of all in chemo man, what we talked about, dil, doxorubicin, dil ke bagal mein lungs, bleomycin, bisulfan. Your hands 5. Okay, so what was 5? 5 thiourouracil or 5 fluorouracil. Then you had your V was all the hands were V, Vincristin, Vinblastin. Then on the top also another V as a head, SIADH, Vomit,
Cisplatin.
Vomit, and this one, what do you say, ototoxicity, nephrotoxicity, cisplatin. And etoposide, cyclophosphamide, hemorrhagic cystitis. No, last 1 week only, 1 week ago, my internship got over. From tomorrow, I am starting my job as an EMO. So that's why I got this all things done before my job.
Congratulations, doc.
Thank you. So that's why, I got this, like, it was a very hurry situation. Like, I was like, I want to get this revision class done because I knew last time also people who attended the session, they told around 20 questions were there. So I'm like, chalo, let us start. See, my main goal, if I'll ask you, tell you guys, is what is my goal out of all of these things is, now I'm going to slowly, in this next 6 months for the upcoming June exam, I'm going to make all 90 subject videos free on YouTube. Because, from last 6 months, I've tried to do this all things. You understand one thing that, like, some people like us are fortunate enough that we passed this exam in one go. But there are few people who, unfortunately, due to some circumstances, are not able to go through 3, 4, 5. Even there are some people who I talked to 8 or 9 times also. Now they're having financial issue and all this, and I feel this other all apps, they try to exploit you more than help you. So if you, once you pass your exam, what I would recommend you also to tell others is that whenever you do, don't tell them, okay, just choose Pano, just choose Peplador. No. What you have to tell them is, choose the doctor. The app will not help you pass. Choose the doctor. For example, if I'll ask you surgery, who you feel is the best? I feel Rohan Khandelwal. So I'll say, fine, choose Pano.
Vinit Gupta.
For you, Vinit Gupta. See, exactly. It is all on your preference. Now, see, I'll tell you one thing. Out of 100 who joined, maybe there are 10 who like me, maybe 10 who don't like me. It is all on your preference. You have to be satisfied with your topic. Are you understanding?
Yes.
Yeah.
So I have a doubt. Actually.
Yes.
So basically, I started my prep very late. So I'm still doing my 5 years of FMG PYQ currently with the revision, the first revision. So it's really hard to fit in the 5 years of NEET PG and 3 years of INICT. And also my second revision is pending. I didn't even start it yet. So I really don't know what to do.
See, it's okay. I'll tell you honestly. See, I'll give you a story of my sister, my own sister, not like cousin sister, my own sister. She had her exam in January. She came to me in December. I asked her a couple of questions. She did not know anything. I told her, just start your PYQs. If you don't understand anything, just understand the bold letter. If you don't understand anything, ask me. If you still don't understand, just mug it up. She got around 160, something like this. She was able to pass. So if, and I'm not just saying you that, oh, my very dur ka rishtedar, front of my eyes, my sister just studied for 1 month. Yeah, I was a big pain in the ass to her. Every day, if she's tired, I will scold her. No, get up, start studying again. No, every day I used to torture her very nicely. She used to cry also. She used to tell my father also, he's torturing me too much. They will also tell, no, let him torture. Because of that, she passed. 1 month is possible because this exam is all about luck also.
Yeah.
149. I have a couple of friends who are stuck at 149. Now tell me one thing: 149, 150. Is the knowledge same or different? It's the same.
Same.
The same.
Just the luck was bad that time that he did not get the mark. He or she did not get the mark. Okay. So make sure you are calm. You have time. I'm telling you, you have time. You have 3 weeks. If you have told me 3 weeks, see. Now look, did you this 4 days we discussed mega revision? How much topics we have discussed? So many topics.
Yeah,
right?
so much.
500, 600 topics we discussed. See, first day was 4 hours, second day 4 hours, yesterday 3 hours, today also 3. So within around a span of 12 hours, 12 to 13 hours, this many topics you discussed.
Yeah.
If now you have around 60, 70 60, 70 days more. If like how we have studied in the last 4 days, if you study like this in the next 15, 60 days, what do you think? Obviously, you will be able to pass.
Yeah, true. Correct.
Sir, I want to ask that, sir, I'm getting constantly GT marks in the range 140 to 150, but I'm not improving. How can I
Which exam are you giving? From which app?
Marrow.
See, Marrow is tough. Okay, first thing. Second thing, if you're not improving in your GD, first of all, exact same questions are not coming, correct?
Yes.
Questions are different.
Yeah.
And then now when you solved, did you recheck your questions which were wrong?
Yes, yes. I rechecked.
What was-
There are a lot of silly mistakes I'm doing, like 20-30 marks, those silly mistakes I'm doing. So I'm not getting confidence actually.
See, so now you know your answer. Why am I asking
Yeah.
you this? Did you check and you checked and you saw that there are silly mistakes? What were your silly mistakes?
Like sometimes there I knew the concept, but during marking I just changed, like you said about the gut feeling and something like that. But I need to give more GTs now, or should I continue revising?
No, don't give more GTs now. Just give one more. Last.
Okay.
You have 3 weeks now. Just give one more in the middle. Okay? Just give one more and don't give. I am telling you, I only gave 3 year. 4 maybe total in the whole 6 months. In the last 3 months, one I gave in the middle. Like I had 6 months to prepare. I started my preparation in January. Okay, I gave one in the month of February, and last 3 I gave only 1 month before exam.
Okay.
So it all depends on perspective to perspective, and you will be able to do it well. No problem. You know your no mistake, you're silly. So you know what I used to do? This is my board, right? So over here in Chennai, when I was in Chennai, I had sticky notes. I used to write sticky note here before grand test what to see. So I used to see that, which I'm repeating now again and again. Make sure you see this all of the above, none of the except, because that was my mistake. I used to be so like, okay, I knew all the answers. I will not see this, and my mistakes used to go. I used to tell my friends, I know this are my silly mistakes. Then what? You know what my friend replies? He's like, at least you know what is your problem. So now you can solve it. If you don't know what is your problem, how will you treat it?
Yes, yes.
So you know your problem is silly mistakes. And you also told them if the silly mistakes were not there, so your actual mark is around 170, 180.
Yeah.
Just because of the silly mistakes it reduced.
Okay.
Huh?
Sir, so basically, I have all these preclinical subjects pending in my revision. So if I'm doing that, is going through the marathon revision enough with the PYTs?
Marathon revision of?
Like just marathon series videos, the very short ones, with PYT topics. Is it
So
okay?
this marathon video is who's putting this marathon? That prep ladder one?
No, I'm actually using cerebellum now.
Okay. I see. I don't have much idea about, but how are they claiming? Are they claiming it's enough?
Yeah, it's actually almost covering all the topics of rapid revision.
Bus, very good. But then tell me one thing. Are you starting this new or have you done revision videos before?
No, I actually done the first read and now I'm in my first revision.
Bus, then focus, because see, if you have already revised some other topic, please don't start anything new. But if this is the new, stick with it.
Yeah. So that's enough, right? With the PYTs.
Yes. With the PYT. See, I'm telling you, do whatever you want, but you should not miss the 5 years FMG, NEET, PG, and I. Bus.
Yeah, okay. That's
Okay.
Dog, while studying, like if we are going through one subject and like while studying one subject, there is this FOMO that shit, this subject is remaining. Then while doing that, like ऐसा एक subject continue नहीं हो पाता है dog, बहुत anxiety होता है, and then I just keep on shuffling subject, and at the end of the day, like I am not done with any of the subjects completely, and after thinking that, it gives me more anxiety.
Okay. I will send you a list. Okay. I will send you a video. Actually, I made a reel on this. How to study subjects with integration. Like surgery. Surgery you can integrate with. You can integrate it with radiology, anatomy. Right? 3 subjects. Because in anatomy surgery they're asking. You can integrate radio. With medicine you can integrate pharmacology, physiology. Such a OB-GYN is completely separate. The way to go through this is to integrate the subjects and teach. Like example of when I was making this all list, randomly like this, like when I was talking, meralgia paresthetica, chiralgia paresthetica are completely unrelated things, but they rhyme and they can be confused. So that's why I cover it now. Now, whenever we're talking about this chronic hypertrophic pyloric stenosis, this is a specific topic for pedia. But this topic also comes in surgery. So what I'm trying to say is, for example, whatever topic you're studying, example, now I'm studying in anatomy, if that word or that topic came in OB-GYN, go OB-GYN and cover up at that time. So that FOMO of the subject, now look, 90 subjects will never get solved. That is my guarantee. It will never happen. One thing what you have to do is Pomodoro technique, and I will tell you my hack, and this hack really let me go for the FOMO. You know what is Pomodoro technique?
Yes, dog.
30 minutes after 25 minutes, okay, 25 minutes you'll do and 5 minutes break you'll take. I did this in the, okay, just random guess. How many hours do you think I studied per day in last 1 month? Yes.
16 hours, dog.
Huh? How
Like,
much?
according to your score, I feel 16 hours.
See, okay, very good. People are also claiming they have studied 56 hours. This is all bullshit. No one can study that much. It's not practically possible. I used to study 7 hours per day. Now I'll tell you how 7 hours per day. When you take 25 minutes session plus 5 minutes break, 25 minutes session plus 5 minutes break, like that 50 minutes happen. In this 25 minutes, for example, like right now, this you can see our total 4 minute session will be 3 today. Today 6 we have done discussion. 3 hours are over. No one moved here and there. I did not talk to my friend, my family, or I did not walk. Effective study hours, you have to do that. Effective study hours. If you have your phone and in your phone you're starting scrolling, going here and there, going on there, that is not effective. That effective, I used to study 7 hours per day. I used to start at 9 in the morning and I used to finish at 8 p.m. If you see 9 in the morning and 8 p.m., it is around 13 hours or 11 hours. But I am not saying 11 hours. I am saying you 7 hours. Because the other 4 hours was time pass. Maybe I went to eat something. Maybe I went to do this. You should not count that. I set up a goal for myself. Ki Angad, if you are able to finish 7 hours per day effective, you don't have to worry about anything else. Medicine took me 3 days to revise. When I was on the first day of studying medicine, I'm like, yeah, how will I finish? But I'm like, through 7 hours I finished. Okay. My goal is complete. Whatever goal per day you're having, at least if 70% of the goal you're able to do, you are going to pass. But you should know that 70 was worth it. You cannot come and tell me, ki, sir, I studied effective hours. Ask yourself, did you study effective hours? Are you doctor understanding?
Yes, doc.
So follow it in that way, because brain, if you will do like this, I'll tell you the reality. If you will now study all of a sudden 10, 12 effective hours, now you will get burned out. I also had one thing in month of April. My exam was in June. Month of April, I had like 1 week continuously. I used to study so much means so much. But that messed up my mind so bad that it took me 2 weeks to start studying again. I was like, मेरा दिल नहीं कर रहा. I don't want to do. I never used to go out. I would not eat food properly because my brain was messed up. You should give time to your brain. Like right now, you are not studying. You are just listening me. In that 5 minutes of break, I used to close the book. I used to go out of my room. Don't stay in the room also when you're studying. Go out to the room, get a different environment where I feel, listen songs, talk to your mom, dad, talk to anyone, boyfriend, girlfriend, they, she, whatever, and then come back. But once you come back, and during those 5 minutes, whatever you do, it should not exceed more than 5 minutes. That is the art of discipline. Are we clear? This integrated subject wala approach, I'll give one more reality. This integrated subject wala approach is not useful now, because now we just have 3 weeks. If you had maybe 6 months, I would have told, okay, study today, surgery. That's why in the timetable which I made, I gave it that way, study this. But now you have 3 weeks. In this 3 weeks, all 90 subjects should be learned together. How? Okay, if you're dying quickly, and it should not be like I told you, right? I speak and study. So it was, for me, it was the last 1 month was very hard because I used to speak everything. So I understood one thing. Okay, I did this PYTs. I know what are the important topics. I will speak that. Rest all I will just read on the top. You can't revise whole thing again. Revision does not mean, okay, whatever you studied whole thing, again you study the same way. Now it will be faster. If it took 4 days to you last time, it will take now 3 days. Then again it will take 2 days. Then in half day you should get it done. Okay?
Yes, sir.
Was it थोड़ा समझ आया या कुछ नहीं समझ आया?
समझ भी आया, बहुत हिम्मत भी मिली सर. Thank you.
So does the integration of subject help us cover it faster than doing it one by one? Can you please tell me about medicine, pathopharma? Yes, correct. Medicine, pathopharma, you will integrate study. Not only it is faster, it will also help you to understand the concept faster. For example, like you remember in the first day when you discussed Liddle syndrome and Cone syndrome. So Liddle syndrome, Cone syndrome, I could just give one table only. But I taught the physiology of RAS system so that now with RAS, you will never forget Liddle and Cones.
Okay.
Tell me, but giving Liddle syndrome and Cons, that would be just ratification. But I taught you the whole pathophysiology. Will you forget now?
No.
No.
Huh? That is the way.
Okay, sir. So,
What all things your sister studied? She also studied whatever notes she had. Okay? Whatever notes she see. Now, any platform, Prep Ladder, Marrow, or Martia, these are not stupid people. Obviously, the doctors who are making the notes also are smart, which means notes are enough. I will tell you, my score was 221, already ranked 9. All India rank 8 was 222. Okay, just 1 mark more than me. He was my friend. Aditya Tikhe, his name is. That guy is a very dangerous bookworm. But like, we are very good friends. Even though All India rank 1 in that time, Kareem Jafar, we are all same from same hospital, same college. Aditya Tikhe used to study from second year. Very hardworking guy. Touch wood, I have not seen a person like him. He finished all marrow. He revised everything. And me, I did not finish whole marrow. I did not teach any prep plan. I did not teach anything. But what I did was, I know, this guy has started. I can't compare with him because already he has done so much for me. So how can I get a bit better in myself is to study smart. Studying smart is doing all the previous year questions. You know what questions are very important, what topic is very important. I will focus on that. That is what I did. I did not study too much detail, so much like extra topics which never came. INI questions, which are very big paragraphical, don't touch them. Just see the bold letter. In all explanation, bold letter is there, right? There is a bold letter explanation. This is because of this. Must move the next slide. If you study the whole explanation, it will take too much time. Study in the form of tables. Tables are very useful. Cancer, breast cancer, thyroid. Okay, breast cancer, thyroid, everything which will be there. Okay, these are all very important topics. Which platform PYQ? You see, I did marrow that time. Prep ladder is also good. You can do. Right now, just give me another couple of days. Okay, in those couple of days, what do you say? We are going to upload on our Telegram change. My friends, see, we are just 3 people together. We're doing it right now. We are going to post all PY previous year topics, 5 years FMG, 5 years DPG, 3 years ID. Per subject, we'll start selling it, and I will let you know. Very cheap, around 50-60 rupees. Okay.
Yeah, doctor, yeah.
So that
Yes,
will.
please, that will help.
I will let you know with
Yeah.
the topics
So
also.
I was also finding some PYQ to solve like last
Exactly
5
that.
years, but
Yeah,
I was
so
not able to find
no
it.
problem. That's why, see, look, if you have to buy for me also, chalo, I had marrow that time. But for people who don't have marrow like this, they just have to buy the Q bank for the PYQ. So that
Yeah.
is why, just in a simple way, all the PYQ around 60, like say anesthesia, only 60 questions are there. FMG, DPG, and INI. Just do that, you will understand what is important topic, finish. Topic only over.
Yeah.
So I will
Okay.
try to, I was targeting for the June exam, but no problem, we'll target it for now only.
Yes,
I'll
please,
try to
please.
upload it in 2-3 days and I will let
Yeah.
you know. Okay?
That would be
Okay.
great, doctor.
So now I just have one favor for you guys. Okay? Last favor. Okay? How was just your honest review with this 4-class revision? How do you think? What do you guys recommend? What should I change? What should I do like that?
It's actually
Dog,
perfect. So
honestly, like you are doing so much with like most of your contents are free only, and this too at such nominal rate. I don't think you can do any better.
yeah, actually,
Yeah.
Change
the
to
time you
no,
put
your
into this,
teaching method is
I mean, your
amazing.
schedule is very.
Sorry?
The time you've put into this amidst your schedule and things, it's really appreciable.
Thank you so much. But see, I really don't want the thanks. I want one promise. One girl had written a very beautiful feedback also. The way you repay me is by passing the exam. Okay?
Definitely.
Exactly.
We will try the
So
best.
Yeah, we
I
will do it actually for you.
promise. See, and I'll tell you one thing. It's not that I'm forcing you guys, because see, the way you guys are answering. Okay, I'm an extrovert in general, but I have heard some people, the way they speak, there are some introverts, but they're trying to speak out. That gives the confidence which you guys have, and trust me, I really feel it. I was talking to my sister also the other day. At least out of 100 here, I feel around 70-80 will pakka pass for sure. Other 20 I can't comment because they maybe never spoke, but I'm not saying that they will not. At least 70-80, and you guys, whoever is listening right now, you also know that you guys are among them. Correct?
Look, actually, because of this exam pattern, we are so habitual of getting the options that when someone asks the question without the option, it's so hard. But like in last 3-4 days, like while attending your lectures, subconsciously those answers popped up, and it really
Exactly.
boosted my confidence.
That is the idea.
Because that was a creature of habit. Now our mind was like that.
Exactly.
It's
Because
able to integrate so many information at the same time.
yeah, so that is the idea. Your brain should work like that.
And
Previously, if
also
anyone
without
would
the
ask
judgment
us,
of being wrong or right. Like we were open with you.
That
Yeah,
is
you
the
thanks
have
for
idea.
not asking us to open
more
our
confidence
cameras.
and interested now.
No, really, I see. That is the thing. See, like the first day, someone asked, "Is this enough?" If I will ask you, if like as a person, I don't know what they ask. Maybe there is a chance that out of whatever around 1,000 questions we have discussed, maybe we can all of them can come. Maybe even nothing can come. But what you have gained here, what I believe is confidence. that okay,
Yeah.
that whether you know, because see now if whatever questions I was asking, okay, something was already written, but I also used to ask something which was not written over there, right? And you were still answering, which means your subconscious mind knows everything. This last 3 weeks, you need confidence to revise. So that confidence now you guys have. You have now 4 hours, 3 hours, you guys have sat every day just by trusting some other person. Look, see, you should not trust me. You trust yourself because your answers were right. Because I was just writing whatever you guys were saying. Correct?
Yeah.
Means you're right.
Yes.
Your answers are correct. You're confident. You all. That's why, see, I'm not just saying randomly. Maybe we might meet, we might not meet. Okay, but still, you, the way you are confidently saying, I have a very high chance that all of you, most of you, will pass. Sorry.
Yeah. The biggest challenge for us was like sitting for this long hours.
And you
Like
guys sat nicely.
haven't ever. Yeah, exactly.
Hello?
Otherwise, most of the teachers used to give some breaks in between.
But
Yeah,
didn't
exactly.
There weren't any break, and we didn't feel any need for a break.
Yeah,
So
that-
yeah, it was. Yeah.
Without getting distracted.
Yeah.
First and foremost.
This is
Sitting
Pomodoro. This is
still.
what I'm saying. You know, Pomodoro, continuously just studying, right? That is Pomodoro. If we and we used to have small talks, but then the talks were very less. It was continuously like 3 hours we just discussing. The first day, you remember, 4.5 hours we studied. In the middle, we
Yeah.
had some breaks because of the Zoom, but continuously till 11:30 we discussed pharma. And then that
Yeah.
topic also, it was not like some easy topic. 11 o'clock, you guys are answering pharma questions. So that shows that how resilient you guys are. Okay? So what I want you guys to do is, whatever doubts you have, anything is there, just text me on Telegram. I'm always there to help. Either it is respect to study or either it is respect to anything, whether mental health or anything. Please, if someone has anxiety or issues, do meditation. If you ask me what I used to do, I used to do Isha Kriya. See, my confidence right now might be, you guys say, oh, this guy does not have any issue. I will tell you, I was so messed up at one time that I had to get 2 ECG done and 1 cardio echo. You know that medical student syndrome, which is also known as hypochondria. Whatever you study, you think it is to you.
Yes, yes, yes.
Huh?
Oh yeah.
Huh? It
Yeah,
happened
I
to
saw
me
your
also.
that video also, sir. You mentioned you also went for some blood tests and all, right?
Blood tests, yeah. See, a lot. Everything happens. But see that I was also very anxious. Now I'm not anxious because I'm in the other side. So don't think that this guy is very confident. No, I was also मेरी भी बहुत बैंड बजी पड़ी थी भाई. Don't worry. Remember I told you this also. कि after the exam I called my sister कि Simran for January we will attend. Together we will study. Okay. So okay, last question. So the whole notes can't be revised at this point, even if the first revision, right? Even though, yes, obviously, how can you do the whole notes? And in the whole notes, how to know which is important is by doing previous year questions. That is why the emphasis. Now, if previous year questions directly will not come, the
Previous year
related topic will come. Sorry?
Previous year topics, right? PYTs.
Yeah, PYT topics. That example, option A, B, C, D. Now, we talked about, see that type example. We were talking about nasopharyngeal carcinoma. There was no relation of craniopharyngioma, but still I talked about it because they might ask. We were talking about fossa of Rosenwiller. It made me strike rat case pouch. So I thought I will ask that question. So FMG is best right now. FMG solution is not best right now. I never said that. I said that previous year questions are best right now. In FMG solution, only FMG is there. FMG solution is a very good book. But if anyone wants to do FMG solution also, only do the black highlighted words if you notice one thing. There are so many random questions. That is like random questions only that never came also. Only the dark highlighted where recent questions are there, recently. Those you have to do. But right now, find a source of getting the PYQ done. If you want, today only I'll upload a couple of whichever. I'll just contact my friend. My friend is only making the whole thing. I'll ask him which will PDFs are done. I'll ask him to send you. Okay?
Okay,
Thank you.
that would
Thank
be
you,
great.
Doc.
Yeah.
Thank you so much.
I have one last request.
Dhanyavad.
If anyone has any clips or anything, if you recorded something or something, this please do send it to me so that I can post it as a reel. Okay, so that other for the future mega revision people, they will have the thing. You know, this thing happened and people were happy and it's not like fake. And I'll send you a last. This is a last form. Okay. Not form, but oh my god. And last form is there. Just in that form, just let me know there are 2 questions there. How was the overall 4 days session? And what was your best moment? That is all. This is just for me because later when I'll be sitting alone, I'll just read and smile. Okay.
Okay.
So okay. God bless you guys. Thank you so much, Sunflower. Take care.
Thank you
Yeah,
so
you
much.
too,
Thank
doctor.
you.
Bye-bye.
Thank you,
Thank
sir.
you.
One last request to you, Doc.
And Merry Christmas, doctor.
Sir,
Merry
one
Christmas.
Merry
Merry
Christmas.
Christmas. Hallelujah.
All the
one
best for your
request to
duty.
you also, doc.
All the best for your duty.
Best moment is
Doc,
right now.
Oh, thank you so much. I have to borrow my emergency. I'll tell you one more issue, okay? Now, 4 days I have been studying. See, it's not like you directly I can come and teach you. I have to study something, then I will teach you, right? So
Yes.
now I have to, my HOD, he told me study about emergency and come everything, okay? Nothing I studied so far. Only so far the tension pneumothorax was something which was related to emergency. Nothing is there. So now after this, now I'll go and call my friend who's the EMO already. To यार कुछ तो बता दे जो अगर you know it will be there. Chalo, one day it is no problem. They will they will teach. They'll keep me with another EMO so that I'll not kill any patient. So yeah.
Yeah. Good
Okay.
luck, doc.
Doctor life. Doctor life.
Yeah.
doc, I'm saying, yeah, like from tomorrow you're starting your job, right?
Yeah.
हाँ तो वहाँ जैकेट पहन के जाना सर, ऐसे फिर उनके भरोसे मत बैठना।
बड़े बेशर्म लोग यार किसी नजर लगी है मेरे को, मैं बता रहा हूँ। आई गेस दैट व्हेन आई टोल्ड लाइक दिस, माय एड्रेनलिन इज सो मच, समवन वाज थिंकिंग इसको जुकाम पड़े।
नहीं सर, मैं तो बस वो बदला ले रहा था। वो आपने बोला ना कि ये लंबर वर्टिब्रा कैसे पता चलता है, तो दो रीजन।
That was the best moment, doctor. Yeah.
The best moment was because मैंने रखा है। मैंने
Because
डाला
even I was like क्या हो, कैसे बोले, क्या करें, तो कहा गूगल से सर्च किए और चलो guys, take care. Okay, चलो
चलो,
whiskey,
थैंक यू डॉक।
Thank you so much, sir.
विस्की को लेके
हाँ
जाइए बाहर।
whiskey. Merry Christmas
whiskey
whiskey.
बाय
My whiskey.
Doc, there's someone else who would like to say hi to Whiskey.
अरे who is it? दिखाओ कौन है whiskey वाला, और कौन है whiskey? देखो शक्ल देखो।
That's Ellie.
Oh,
I don't know if
My
anyone can see
whiskey.
her.
अरे और गोल्डन रिट्रीवर भी है, अरे गूगल, वाह 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 वाह। ओह चलो guys, take care.
Even I had a dog. Like I am missing my
Thank you so
dog.
much for your
I
time.
had a Kuwaiti
Thank you so
dog.
much. Miss करो, very good. चलो guys, see you
I
guys.
had a
Please
Kuwaiti
just
dog.
finish that
Bye.
form. It will really mean a lot, guys. ठीक है? Thank you.
Bye.
Sure,
Thank you.
Bye.
sure.
Bye, sir.
Bye
Bye.
bye.
Thank you so much.
Most welcome. Take care. Bye bye. क्या चैट में कुछ लिखा है?
एक बार वो पंजाबी वाला गाना गा दो ना डॉग।
तो मजे ले रहे हो,
Jesus
कौन हो
वाला।
तुम? चलो आज करेंगे हालेलुया हालेलुया, यल्ला चलो।